When assessing the squat, generally in the bottom of the squat, we're looking for the shin angle to closely match the angle of the torso. In some cases, an individual may flop forward. Now they might do this at the beginning of their lift. You can see they go forward so that at the bottom, this angle and this angle are very dissimilar. And in that case, if they initiate with that forward flop, that is often a poor movement strategy. There's another variant whereby somebody may squat down and as they get deeper, they flop forward as they descend into the squat. And there's a lot of different reasons that that may be happening. One is that there may be a limitation in dorsiflexion in the ankle, so a restriction in the ankle, possibly due to tight calves. Another reason is that the foot placement might be a little bit too close for that individual's capacity. A further reason could be that further up the kinetic chain, they may have lower cross syndrome, some excessive tension in the quads and hip flexors may be predisposing them to forward flexion. In addition, they may have insufficient core stiffness. So the transverse abdominis isn't providing that inner unit core stability, and that could be due to just conditioning or poor breathing pattern. It might also be a lack of upper back stiffness because they're going with more of an overhand grip on the bar, their elbows are flared out to the side, or they've got a really high bar placement that's throwing them forward. Either way, there's many different potential causes for this. It could also come down to structural predisposition. Some people have different levered lengths because they may be longer in the tibia or the femur. So you want to be able to make sure that we're not potentially putting the low back under risk by allowing that forward bend strategy from the spine, and we need to either help to alleviate some of the underlying postural dispositions related to imbalances in tension, or find a variant of the squat that best matches that individual's structure so that they can do it in a way that's not going to potentially create pain or injury.